All right, folks. So it happened. Elizabeth Warren has officially exposed herself as a complete fraud on the issue of Medicare for All. Now, this is an issue that I have brought up multiple times and explained to you guys that if you are equating Bernie Sanders and Elizabeth Warren, you're crazy because they're simply not the same. The way that Bernie Sanders is going to fight for Medicare for All, Elizabeth Warren's not going to do the same for you. And so that's why equating the two is an incredibly, ridiculous assessment. And I've been saying that for the longest time now. Elizabeth Warren has been saying she supports Medicare for All. But it seems to be the case that it's not so much Medicare for All, but a public option that she wants to then fuse into Medicare for All, which is really ridiculous. But she sent out this tweet thread saying, "In my first 100 days, I'll fight to create a true Medicare for All option that will be immediately free for millions of Americans, including children under the age of 18 and families making at or below 200% of the federal poverty level. This option will include all of the healthcare benefits of Medicare for All, including primary and preventative services, pediatric care, emergency services and transportation, vision, dental, audio, long-term care, mental health and substance use, and physical therapy. And I'll give every American over the age of 50 the choice to enter into a substantially improved Medicare program. Millions of Americans will experience the full benefits of a hashtag Medicare for All option and see how it compares to high-priced coverage and fighting their insurance company tooth and nail. And when we move to complete the transition to hashtag Medicare for All, the choice will be clear." This is the weirdest part of this, okay? And if you click on the link, which goes to basically her long explainer of this, it basically says, "And finally, no later than my third year in office, I will fight to pass legislation that would complete the transition to full Medicare for All. By this point, the American people will have experienced the full benefits of a true Medicare for All option, and they can see for themselves how that experience stacks up against high-priced care that requires them to fight tooth and nail against their insurance company. Per the terms of the Medicare for All Act, supplemental private insurance that doesn't duplicate the benefits of Medicare for All would still be available, but by avoiding duplicative insurance and integrating every American into the new program, the American people would save trillions of dollars on health costs." Now, this is very, very problematic. So what she's saying here, she's gonna try to pass two bills, which is hilariously dumb. Also, I'm incredibly irritated and frustrated with the usage, and I'm gonna use the term appropriation here, because that's what's going on here. There's an appropriation of the term Medicare for All going on. In fact, it's been going on for quite a while now, but this is just peak madness, where you're saying Medicare for All option. Medicare for All option is the ultimate oxymoron. There's nothing more oxymoronic than that. It's not Medicare for All option, it's for all. So it's not an option by definition. That's the whole point. So presenting this as an option really ticks me off as someone who's a real M4A supporter. Listen, dude, if you support a public option, then go ahead, rep that. Don't lie to the people about what you support. That's not cool. You're frauding. Don't do that. The idea of the choice will be clear. And we're going to get to that because that's problematic as well. Obviously this, second piece of legislation that you would try to pass to then do it is utterly ridiculous. That is such a dumb idea. It's insane. But to the point of, it'll make the choice clear. This is actually something we heard from Mr. David Pacman as well. Let's hear him out.
Universal health care, it doesn't necessarily follow that you make private insurance illegal. In fact, I don't think that should be a priority. Let private insurance exist. If the nationalize the universal healthcare system, Medicare for All or whatever else, is good enough, people are going to prefer it over private insurance. And this will naturally, as the free marketers like to say, it will naturally do what needs to happen to private insurance. A public option is something else. And studies have shown that public options would only lower premiums by about 7 to 8.
So basically what he's explaining there is that there would essentially be this option that, it would just flesh itself out. It would just flesh itself out, it would clearly prove that it is essentially superior, and therefore people would be ready for the switch. Also, there's this sort of fundamental issue that I have with Elizabeth Warren's notion that people need to be swayed, that they don't already support Medicare for all, that it's something that, she's been doing this nonsense where she also refuses to say, that yes, the taxes will be raised, but doesn't explain, of course, that that's offset by the, loss of premiums that's being paid. So instead of paying, incredibly high premiums for crappy care, you're going to end up having, a little bit more of your taxes paid, which is a much better system. But what you're talking about here, and he is kind of explaining a public option here. I don't really understand what he even means here by that. But what you have to understand about a public option, or this option, whatever the hell you want to call it, this is a public option, folks. That's what this is. This is a public option. It's just being free to, certain people, so it's going to be an incredibly high risk pool, especially if you're putting every American over the age of 50, on this Medicare program, which obviously we want everybody to have Medicare. But the problem with this is if you have, and this is the basic fundamentals of how insurance works, and we're going to go through that. I'm going to try to explain this to you folks, because we all know the word insurance. There's all kinds of insurance. There's health insurance. There's life insurance. There's car insurance. There's even, insurance for financial, instruments, like credit default swaps. So, with MBS and all that kind of stuff. So there's all kinds of insurance, right? But what fundamentally is insurance? So what we're going to do here is we're going to pull this up here and just do a little bit of an explainer. So when it comes to insurance, okay, when you're talking about insurance, think about car insurance, right? It works like this way for every insurance, okay? The people who are healthy, or in other words, are not, prone to car accidents and not having the car accidents, are the ones who are subsidizing the people who are having more car accidents. So in the health industry, what that means, the health insurance industry, what that means is people who are sicker and older, okay, people over 50 and who have chronic issues and things like that, and they're more likely to be sick, need to be offset by younger, healthier people. That's how risk pools work. You calculate premiums based on a risk pool, and you look at basically, how much are we going to need? And if you have a high risk pool, which is what the Republicans were stunningly trying to explain was going to fix the problem of people who are, old and have pre-existing conditions, it was going to solve it. That would make it the absolute worst, by the way. The solution to that is having one massive risk pool, because then you've got a bunch of people who are offsetting, the sicker people, and that's the way you want to do it. So if you have an option, it's going to get bogged down because that option will just be full of people who are sick and old. That's what's going to happen. That option is just going to have, poor people. It's going to have old people. It's going to have sick people. And also what you got to remember as well is in the United States, we're essentially an oligarchy, to be honest with you. So there's an incredibly high odds and chance of just straight bribery, just lobbyist corruption, etc., just ruining the system. So you've also got to keep that in mind as well. Health insurance companies are going to do everything they can to make sure that option fails. And we have a fundamentally broken system, or the system is set up the way it is and we need to break it, whichever way you want to put it, that would allow them to essentially assert all of their influence and to, just completely mangle the option, and I hate that it's an option in the first place. But, I kind of skipped over how insurance fundamentally works. So, insurance fundamentally works, right? Let's just, talk about health. We're talking about health insurance in this situation. So you've got your health insurance company here, okay? And then you've got a bunch of people, right? The people who are insured by this health company, okay? And these people pay each month. They pay a premium. Okay, they pay a premium. So they pay a premium each month to the health insurance company, and in return, what happens is, the health insurance pays for the doctor's visits, although people pay co-pays as well. They pay for doctor's visits and prescriptions, etc., etc., all that kind of stuff. So, what happens if all of the people who are on that health insurance plan are all incredibly consuming, those health services at a high level? All of them, or most of them. What happens? Well, the premiums are going to be super high. You know what also happens in that scenario? The payout is less. Doctors stop taking it because they're not making enough money from it. So it's a complete recipe for disaster. It is a complete recipe for disaster. You need young, healthy people to be able to, offset those old sick people. And that's just the way that you need it. So this idea that we're going to do this in an extremely corrupt and oligarchic system is hilariously stupid. On the one hand, I'm glad that Elizabeth Warren, actually, I take that back. I'm 100% clear. I'm glad she exposed herself as being a fraud, because to be quite frank with you, I'm very glad that we really truly know where she stands. I also saw that Pramila Jayapal was defending her. I don't know why she was doing that, because her plan does not align with hers. Elizabeth Warren's plan is like, I'm going to pass 2 pieces of legislation. We got to do this dumb option crap, and then after that, we're going to sign a plan. It's so different from Bernie Sanders' Medicare for All, it's not even funny. It's not even funny. But just, I want you to understand the fundamental basics of insurance, okay? And that's just the way it works. Car insurance, if you get into accidents a lot, your premiums are going to go up because they keep paying out money, so they're going to need more to, keep making money, because that's the way the system works. You get into more car accidents, your car insurance ups your premiums, If you're more likely to have one, they're going to already have your premiums higher. It's just that's the way insurance works. So imagine being so stupid as to having a health insurance option that plops all of the people who are overconsumptive of healthcare and those health services on one option. That's the dumbest thing I've ever heard. You would have to be incredibly stupid to do that. And Obamacare, had some provisions to try to prevent this. Now, those have, for the most part, been completely removed. And that's why we need to go to Medicare for All. If you put a bandage on a massive wound, it's real easy to pull off that bandage, isn't it? But if you, if you close it up, surgeries, stitch it up, it's pretty hard to remove, right? You can't really do it. So if you put a lame bandage on it, it's not going to do anything. So the provisions that the Affordable Care Act provided to try to do this, there were these subsidies that the government would give to insurance companies who had these, very high-risk individuals, so that they could maintain their system. And that's why, remember back in, I believe it was 2017, there were a bunch of health insurance companies pulling off of the exchange. It's because Trump stopped those, cost-sharing subsidies. That's the reason why, because he wanted to kneecap it and to take it out. The other provision they had in, I think they might have even had another provision other than that, but obviously you guys know the individual mandate. The individual mandate wasn't removed, it's just placed at $0. So the individual mandate, $0. But if you force people to get insurance, then you have, a bigger risk pool. That was the point of that. So, there's some sort of fundamentals there that exist that sort of understand, like, okay, we have a problem, and we know that, this is the type of solution we need, but it's always this stupid bandage that's used. Stop using bandages. We need some serious, work done. We need a massive solution, because this isn't working anymore. I'm sorry. It's just not working anymore. So, you need a full-on system. There will be a transition period. So, and I don't know the exact details of the way Bernie's would work in terms of the 4-year transition, but I know obviously it's not, a 2-year, 2 legislation piece, and also it doesn't have that, after everyone's convinced, blah, blah, blah. It's going to be a transition period of 4 years. but the way the steps go will be very, very different. I hope that helps you understand some of the stuff. But Elizabeth Warren is no Bernie Sanders, folks.